Good afternoon. I'm Steve Forbush, and I'm the owner and proprietor of Orthopedic Manual Therapy Instruction. And our purpose is to try to improve people's clinical skills by improving their orthopedic expertise, and have a certification series and have a bunch of courses that help people to be better clinicians. Hopefully, right away, as soon as they complete a course, they should be better in that particular area in a clinic right away. Today I want to talk a little bit about blood flow restriction. Now, blood flow restriction has been a little more popular over the last 7 to 10 years, and it's been instigated in the United States and pushed forward by the institute down in Texas, run through Johnny Owens, who's a physical therapist. Johnny has done a lot of research on trying to get people back from war injuries, massive limb injuries, and other issues that have been really difficult to treat in the past. And you think about it, the reason it's so difficult is because they don't have good tissue. They have multiple fractures. They have other issues that are there. So we want to create healing, but we can't put load on the tissues. They're too fragile. And so what they came up with was some revamping of some old literature and some old pieces of information from Japan, where they started talking about KATSU, KAATSU, and they decided that using this type of blood flow restriction changes your physiological response to exercise and from the anaerobic stresses you put on the tissues. It's actually been shown now in multiple studies that anaerobic stresses on tissues during exercise are the best predictor of increasing muscle mass, assisting with strengthening, and assisting with other hormonal responses that normally you would get with exercise. So that's sort of where we're coming from when we're talking about this. So I do believe that there's no clinic in the United States that is an orthopedic outpatient clinic that sees patients post-surgically or post-injury from musculoskeletal strains and sprains that should not be using blood flow restriction on those that it's effective for. And it's mostly effective for anyone with that type of post-surgical condition, especially something below the hip or below the shoulder. And it could be effective even for people that have shoulder injuries and for hip injuries and pelvic and lumbar spine problems. But that's not where most of the research is. Right now, most of the research has been at the knee, foot, ankle, and at the elbow, wrist, hand, and upper thigh, upper arm. And the purpose of blood flow restriction is to create an environment where there's some blood that's going into the limb, but minimum blood coming out of the limb, which allows it to be in an anaerobic condition. And there's a particular set of exercises that are used in order to make that a more effective tool. So let's talk about some of the parameters. The first parameter is that in order to use blood flow restriction, there are 3 different ways it can be used. It can be used as a prophylactic or as a pre-surgical, something that is done for people that are infirmed and can't really do exercise. And what they do is they put the cuff on for a certain length of time. They take the cuff off for a certain length of time. They put it on again. They don't really even have to exercise with it. It creates an anaerobic environment and creates a healing response within the tissues. So if someone's gone through a complicated pinning of the femur or a multiple screw fixation and wire fixation of the tibia because of a very significant commutative fracture, the blood flow restriction can be done on those limbs even though there's no exercise being involved. So that's the first way. Second way is by using it as a means of enhancing strength and mass. And that's done with using the tool and using some resistive exercise. It's suggested that the resistive exercise be between 20 and 50% of a normal maximal load. And it's pretty much agreed upon that there's a certain sequence of exercises that are the best. And they suggest for each exercise you do, You do 30 reps under cuff with the resistance that they can tolerate, which say 20%. So let's say they can normally lift 100 pounds with their quad. You're doing a 20-pound load, 20-pound lift, doing 30 reps under cuff, 30 seconds of rest while still under cuff, 15 reps with resistance, 30 seconds under cuff still as a rest, 15 more reps, 30 seconds while still under cuff, rest, and then a final 15 reps. So it's 30, 15, 15, 15 with 30-second rests in between, and then you deflate the cuff. Now it's suggested you can use anywhere between 1 and 5 exercises while under cuff. They really want you to limit the total time under cuff, so that's one of the reasons they do that. They suggest the reps be done relatively slow, so there's an eccentric 2 and a concentric 1, or a 2 to 4, something that shows you that difference between eccentric and concentric. And it is the primary thing that we look at. So if we're doing upper extremity versus lower extremity, I'll talk to you about pressures in a minute, but there's slightly different pressures you use for the upper extremity versus lower extremity when you're putting them under the cuff. Okay. The third type of exercise is aerobic exercise. And aerobic exercise can show dramatic changes in aerobic capacity, but again, the tissues have to be put under the cuff for a certain length of time, and then a rest period for a certain length of time. It's usually 5 and 3, but 5 minutes on, 3 minutes off. Okay, but that's somewhat debatable still. Some of the research is showing different values for that, but that's where it is. So how do we determine what pressure to put the cuff? So what you're going to suggest, and what the research has been pretty consistent on, is that you use 80% of the occlusion value for the lower limb and 50% of the occlusion value for the upper limb. So how do you determine occlusion value? Well, there's several ways of doing this. If you buy the unit that Johnny Owens is very connected to, and you buy the Delphi unit, the Delphi blood flow restriction units, you have to be certified through Johnny's course structure in order to order those. But when you use those, they have an automatic set. So you set it for 80% of the occlusion value, and it'll determine that for you. And then you work your exercise off that. If you're not using that cuff, another cuff system that is very effective for doing that is this smart cuff system. And they also have the ability to determine that 80% or 50% value for your resistance, your occlusion value. And that is also something that is FDA approved, and it works well, and you can buy a system from Smart Cuffs. The third way is by doing a Doppler. And what you do is you do a Doppler on the distal limb, at the wrist or at the ankle, and you start occluding the pressure until you have full occlusion, and that's the occlusion value. And then you would take 80% of that for the lower limb or 50% of that for the upper limb. Okay, so why blood flow restriction? What's different about this? Well, interestingly enough, I've been practicing now for about 44 years. In the 44 years I've been practicing, I have never seen anything have the effect that blood flow restriction can have. I've always said there's really nothing new under the sun. If we're exercise specialists, we learn new exercises. We've learned new ways of attributing exercise to a particular muscle group. We've learned new ways of trying to get people past their surgical insults, and typically involves earlier motion and then adequate healing time. What we find with blood flow restriction is that healing time is reduced significantly. That hormonal changes in the body under the anaerobic stresses are very dramatic, and so we have very much increase in the ability to create new blood vessels. We have increase in the venous returns. We have an increase in growth hormone on people even that don't really produce much growth hormone. We have increases in all the positive things that have to do with exercise, but none of the negative things that have to do with exercise. So the things that are contraindicated for blood flow restriction are people that have significant blood flow issues to start with. I mean, if they have arterial occlusion problems, if they have venous, significant venous return issues, if they have any kind of issue that cancer in the body where we don't know where it is and it's potentially going to be manifest by this. Remember, we have a global hormonal response with blood flow restriction. So I'm not sure I'd use blood flow restriction on someone that has an active cancer because it's potential that it would enhance the healing and the growth of the cancer too. I don't think people use it very much in pregnant people because, again, pregnant women are less likely to not have complications in pregnancies. And if you happen to be doing something that's unusual with a pregnant person or pregnant woman, and they have a complication, that potentially that might come back and haunt you. Though I don't think that's much of a complication for this. You know, I think of it in terms of if I'm creating an increase in growth hormone, and the woman that's pregnant has this fetus that's getting this extra growth hormone through the placenta, I'm not sure I really want to do that. But all in all, we see several things that are very dramatic with blood flow restriction. The first thing and the most important thing is that blood flow restriction creates an increase in muscle mass that's dramatic. It doesn't occur as well with anything else. Even if we do high intensity training, blood flow restriction has a tendency to increase mass more than high intensity training. But it's much better than any of the low intensity training you might do as a therapist. So if you're sitting there working 3 sets of 10 with 10 pounds on the lower extremity or light cuff weights on the lower extremity, and you're expecting to get a strength response, you won't. But if you work with blood flow restriction, you're going to get a mass response. And secondly, you will get a strength response that's almost as good as high intensity training. Not quite as good. High intensity training is the best for strength response. But blood flow restriction, this blood flow, low load exercise, has almost the same effect on strengthening as high intensity exercise does. Very, very minimal changes between the two. So to me, if we're working with a post-surgical condition, you're basically saying the healing will occur quicker, the bone will get denser quicker, the ligament will heal more quickly, the muscular tissue will heal more quickly, you will not lose muscle mass, and you will gain the strength that you would normally be able to do. Now, typically, after surgery, I may not be able to do any resistive exercise that's significant, especially not high intensity, for at least 6 to 12 weeks after most surgeries, if there's muscular involvement. I'm going to suggest that blood flow restriction you can do with 20% of the load. So many of you therapists are doing that already early on, but you're not getting the responses other than saying, I want to stimulate this muscle and I want to stimulate the neuromuscular connection. So again, I'm just going to suggest, I personally am not using Delphi units at this point. I use 2 manufacturers that assist me in giving me equipment so I can teach courses on blood flow restriction. One is the Smart Cuffs system, and it comes in a package, and the full package you can buy that has multiple cuffs and the ability to set the parameters of what the occlusion values are, and alternative pressure regulators, okay, for a really reasonable cost. And the other is the H Plus system. An H Plus system is a system, it's actually spelled out HPLUS if you look on the website. But that system has a really nice cuff. It doesn't set the pressures for you. You have to get a Doppler, and you're going to use the Doppler to determine that pressure. It's pretty easy to do. But the system is good, and they have all the components you need in order to do blood flow restriction at a reasonable cost. So the Smart Cuff system or the H Plus system are both really great systems, and it depends on which you prefer, and I would suggest you try them and see what's going on. We have a full course on this through Orthopedic Manual Therapy Instruction, orthomti.com. And if you would like to have that for your area, we'd be glad to come and do that for you. But I think you should be using it within your clinics. So thank you for your time and energy today, and I'll talk to you again soon. My name is Steve Forbush, orthomti.com.